which you will not get from ordering online or buying over the counter,
Okay.
is the expert advice that we dermatologists give our patients. So it's easy to buy a medicine for acne. You could just ask the pharmacist.
Hey everyone, I'm Dr. Kristine Alba Kiat, and this is Chat with Peds, where I interview experts in the field in order to empower you and give you the confidence to raise happy and healthy kids. My guest is a colleague and a good friend, Dr. Louella Ramos. She is a board-certified dermatologist of the Philippine Dermatological Society, and she's also the chairman at Southern Isabela Medical Center, Department of Dermatology and Venereology. She's a wonderful resource for any questions I have about my patient's skin and my skin as well. Join me as I welcome Doc Ola. Hi, Doc.
Hi, Teen, and hi everyone who's watching the YouTube channel of Dr. Teen Kiat.
Yeah,
Thank you for inviting me. It's an
yeah.
honor to be part of your show.
You're so busy. It's so hard to catch you, Doc. So I'm so glad
I
matutuloy na tayo.
see.
Thank
Tsaka
you.
acne kasi, ito pa, when we treat acne, it's like, yeah, you have to explain to the patient and to the parent kasi magastos din po, di ba? So we have to tell the parent na it takes a lot of commitment kasi hindi siya 1 week, hindi siya 1 month lang nagagamot. Sometimes, sa mga bata, parang they really don't care kung ano yung binili ng nanay nila na gamot. Eh, ang mahal-mahal, di ba? Sometimes when they come up for follow-up after a month, hindi pa nakakalahati yung tube or once, twice pa
Ah,
lang nagpahit. So those are the things we really have to consider. We have to uh, tell them the importance of being compliant to the medications. Kasi the long-term effects, sometimes we really I really give them proactive management. Kasi not just to treat the active acne or the inflammatory ones, pero ang important aspect of management is to prevent the long-term consequences of acne, which are your acne scars. So ito yun, di ba? Kanina, the active lesions, now we go to acne scars. It's very important that when you treat, you also take them into consideration na they should be prevented. That's why we have to be proactive with the treatment. So, acne scars, it could be yung post-inflammatory na erythema or kung minsan yung hyperpigmentation, which is mahirap, or scars which could be elevated or hypertrophic, or mas mahirap yung atrophic scars. Kaya nga, di ba, like, nagbubutas-butas na yung mukha dahil kinutput na
mm,
and everything. Yes. Although we do have treatment modalities also for those types of acne scars, but it's better if especially for young patients that we already tell them, educate them, and enlighten them on the importance of compliance to the medications. Kasi mas mahirap ng gamutin yung acne scars.
okay. So, moms, dads, and teens that are watching, sabi ni Doc Ola, hindi to short term, parang commitment talaga yung acne treatment. So
Yes.
just uh, follow the directions from your dermatologist. I see. Yeah, that's good. So, Doc, if so, how can there are over-the-counter products like how to treat acne? I know there are different types of severities, no, my mild, my moderate, and severe. But how to treat acne, and when do they see a dermatologist?
Yes, actually, we have a wide armamentarium of treatment for acne, and sometimes the problem is when patients self-medicate. Okay, so if you have the mild type, actually our range of medications for acne, we have the topicals. It could be as simple as an adapalene or a benzoyl peroxide or a combination or a clindamycin. And these topical meds could come in form of cream, gel, combination, among many others. The older ones, we also have resorcinol. We have formulations, different formulations actually. And then we also have oral medications, a lot. We also have the oral antibiotics, which are specific for acne. Although sometimes doxycycline, you can also use this for acne. Pero we have newer formulations now which are used only for acne to prevent resistance or cross-reaction with other when it is used with other antibiotics like limecycline, okay? And other oral medications would be the oral contraceptive pills, and the gold standard still is the oral isotretinoin, okay? And other treatments that we use in acne, so these are palliatives. Sometimes we do procedures, like we do intralesional injection for really big big lesions, or you're in a hurry, you have an event to attend in 3 days, and you have one acne which you want
Yun
to
na
go away
shrink.
right away. Yes, mabilisan. No, there are yung mga acne patch. I see a lot of those. Even in K-dramas, nakikita ko naka-acne patch sila.
Oh,
Diba?
uso na ngayon.
And, oo. Diba? Oo, ganun sila. I think that sometimes, I think those contain, parang salicylic acid to dry up the lesions right away. And also, we have a lot of procedures. We also have a lot of lasers, like diode laser. We can also do that to dry up the lesions right away. And there's a different set of lasers to treat acne scars. You can, for the acne scars, for the atrophic scars, you can do carbon dioxide laser or Bimyag laser. And for the hyperpigmented ones, you can use the Nd:YAG lasers. For me, sometimes I tell my patients, it's okay if you use over the counter, as long as you know what the ingredients are, so that if you have an adverse reaction to that product, you'll know which product or what that product contains, which you are reactive to, so you don't have to use it again. Okay.
Okay.
I always sometimes, di ba, online, mga bata ngayon, ang hihilig nila, ang mamahal na mga binibili online. And they even buy yung mga set. For me, the importance of going to a board-certified dermatologist, which you will not get from ordering online or buying over the counter, is the expert advice that we dermatologists give our patients. So, it's easy to buy a medicine for acne. You can just ask the pharmacist. There are over the counter. In fact, sometimes the medications that the pharmacist or your friends will recommend to you will be the same as the ones we will prescribe. However, for me, it's very essential. The things that the dermatologist will tell you, like, i-explain ba nila sa'yo paano ka nagkaka-acne, and importance of compliance to the medications. Kasi sometimes if we don't explain it to them, like, when you give medications at the start of the treatment, there's what we call downtime. Ngayon, natawag nila doon purging. I actually learned that from a patient pa. You explain to them, di ba, na after 2 to 3 weeks, maglalabasan po yan. That's part of the treatment. Ganun. Sabi ng patient ko, ayun po ba yung purging? Sabi ko, tama nga naman. Di ba?
No, hindi ko rin alam yung purging na yun na nababasa ko
Oh,
din.
oo, nakakatuwa. Parang ako po yung natuto sa patient ko. Oh, tama nga naman, because it technically purges out the microcomedones. It's still down there, di ba? When I really explain to patients, meron akong drawing, meron akong diagram, kasi it's a way of encouraging them para mas maging successful yung treatment if you are able to explain it to them. So, it's still worth it na magpa-consult sila with a board-certified dermatologist to have the proper advice. Tsaka yung mom na rin, the parents na rin, not just the patients, para mabigyan din sila ng tamang information. Tsaka sometimes explain to them na bakit, kasi di ba, among friends yan, yung mga friends, ako ganito ginagamit ko, ako pinainom, ako pinapahid lang ng ganito. So, part of educating the patient is we tailor fit according to your needs. So, as I've mentioned kanina, di ba, depende yan sa severity, if it's just mild, moderate, or severe. So, mas maganda pa rin talaga if they consult a dermatologist for proper skincare.
Yes, of course, Doc. I agree. Iba pa rin na naka-tailor fit sa teen, sa patient, yung treatment plan.
Yes,
At
yes.
syempre, kailangan ma-monitor din ng dermatologist kung ano na ang na-try and ano yung the best for them.
Yes, yes. Tsaka there are different types of patients, 'di ba? Like there are patients na hindi sila masaya kapag isa or dalawa lang ang pinapapahid mo sa kanila. There are patients naman who be more compliant kung yung combination na para mas madali, isa lang yung paghilamos lang sa umaga and gabi, isang pahid lang sa gabi, ganun. Yung iba naman, they gusto nila yung may toner pa in between,
May
everything, the work. So you also have to look into the patient kung ano yung saan siya mas magiging okay, tsaka magiging mas flexible siya. Kasi isipin mo pa rin lagi yung outcome na successful yung treatment regimen.
Okay, okay. So, Doc Ola, for patients who want to reach you, how can they reach you?
Yes, actually Mondays to Fridays, I'm at the Southern Isabela Medical Center, Department of Dermatology and Venereology. We actually have our dermatology center there, and we have a lot and array of treatments if you have for your dermatological needs. Hindi lang acne, actually, marami po. We have a wide range of services for your needs, not just the aesthetic po ha, but your pathologic diseases. We cater to them. And on Saturdays pala, Saturday sa Matbay Private Clinic at the Heritage Building, Room 216, every Saturday afternoon lang po. And if you cannot, if you have quite urgent needs and would prefer to have an online consult first, you're free to check out the Facebook page of our department. Just type in at SIMC, capital letters SIMC, capital letter D, and then small letters ERMA for our page. And we would gladly answer your queries, your teledermatology questions. So that's at SIMC Derma. That's our page.
All right. Thank you, Doc Ola, again.
Thank you, Tin.
Bye.